Hi everyone, I'm Dr. Roman and I'm a hematologist oncologist, and I'd like to do something a little bit different. So for those of you who have a diagnosis of cancer or have a loved one who's been diagnosed with cancer, or maybe you have a cancer risk factor, we live with a sense of fear. And I say we because those of you who follow my channel know that I have an IPMN. Actually, I have two IPMNs, which is a risk factor for pancreatic cancer. So that's right, there's a risk that I may develop pancreatic cancer in my lifetime. And it's not a fun thing to live with. And I want to do something with some of these videos that's a little different. We always hear about the cancer case who does very poorly, or so and so got diagnosed with cancer, oh my god, everything is negative. And I want to do the opposite. I want to present some good cases, some what I like to call encouraging cases. And the reason I want to do that is because I have found that through my practice, even though I do see bad cases, and yes, that does do funky things to my mind, it plays mind tricks on me. So that's kind of the bad thing of my job, that I have an IPMN and I'm also treating cancer patients. So that's right, when I see the bad cases, it does mess me up a little bit. But then I see good cases where patients do well, and I have to say it really helps me out. So I said to myself, if it helps me out, I bet it would help somebody else, including yourself. So that's the whole reason for these videos. This is the first one that I'm gonna present, and give me your feedback. If you like it, subscribe, give me your feedback. Tell me if something, if this is something that's helping you, because I really don't need to do these videos. I have other things that I could be doing, but again, it's really helping me out, and hopefully it'll help you out. Now, I do want you to keep in mind that I'm not giving medical advice. I'm not your doctor, so I'm not giving any recommendations. Number two, this person will be kept anonymous, so no, everything's going to be anonymous. So I'm going to make sure it's kept that way. I also, even though I'm going to keep it anonymously, I asked permission from the patient, and they actually said yes. If it can help anybody else out, they were more than happy to help out. So I'm really thankful to this patient for allowing me to present this information. So and remember, this is not a typical case. I don't want people out there to say, well, my case didn't go the same way. Again, I'm just presenting cases where patients did very well, and that's the bottom line. I'm really trying to do this to help you out. So without further ado, let's jump in this case. So this is a pancreatic cancer case. So this one is near and dear to me for obvious reasons. So this is a person who was found to have a mass in the head of the pancreas. This mass was about 3 centimeters in size. This was on imaging. Now, a CT scan was done, found this mass. The patient underwent an endoscopic ultrasound, biopsy was done, and it revealed an adenocarcinoma. A PET scan was done. Remember, a lot of times the surgeon is involved, the primary care is involved, the oncologist is involved, the gastroenterologist is involved, and sometimes several scans are done. So even though a CAT scan was done, a PET scan was also ordered by another physician. And the crazy thing was the PET scan was normal. It was negative. So go figure. Now, I love PET scans. I do think that it's another essential tool that we use in oncology, but in this specific case, the initial PET scan was negative, even though the patient had a biopsy-proven pancreatic cancer. So it is a little bit scary, if you ask me, but it is what it is. Nothing in medicine is 100%. So an MRCP was done. The surgeon wanted to know, get better pictures of the pancreas, and an MRCP was done, and it showed this pancreatic mass, and it appeared to be resectable. So on March of 2021, the patient underwent the famous Whipple procedure, which the patient did very well. I'm looking down at my little sheets to make sure I give you all the information. At this time, the CEA was normal. The CA19-9, which is a tumor marker specifically for pancreas cancer and of the biliary tree, gallbladder, although it's a non-specific marker, but it was around 200. And the liver function tests were a little high. Alkaline phosphatase as well as bilirubin was a little bit on the high side. Nothing crazy, but these were somewhat abnormal. So the patient underwent the Whipple surgery and they did well. Now, on pathology, it was demonstrated that the patient had a 4 centimeter adenocarcinoma with 6 out of 9 involved lymph nodes. So they took out the head of the pancreas, several of the lymph nodes around the area, and unfortunately, 6 of 9 lymph nodes were involved with adenocarcinoma. And if you know anything about pancreatic cancer, that is not a good finding. Also, the patient had a microscopically positive margin. So in oncology surgery, when a tumor is taken out, you want to make sure that the tumor is taken out, if you can, if possible, in its totality. You do not want to leave one cell behind if you can. If a little piece of the tumor is left behind, we call that a positive margin. That's not a good thing. It means that part of that tumor stayed behind. And that little piece of the tumor can regrow and it'll just become another tumor. So that's what we call in oncology a positive margin, positive not being good, okay? So, of course, the patient underwent a very large surgery. The surgeon said they cannot go in to try to obtain that negative margin, which is what we want. We want the whole tumor to come out. So that's at the time that the patient came to see me. So I had a lengthy discussion with this patient. Mind you, this was in March of 2021. Patient was very particular. He just did not want aggressive chemotherapy. He really did not want radiation. We compromised, so he finally agreed to a combination of chemotherapy and radiation. And the way we did it in this particular case, because he was very specific on what he did and did not want, we both compromised to give him gemcitabine, which is a type of chemotherapy, for a few cycles. Then after this, the patient underwent radiation therapy because he had a positive margin, okay? There was a little bit of tumor left behind, together with another chemotherapy agent, which is oral, called capecitabine. So capecitabine and radiation, and upon completion of chemoradiation, the patient underwent a few more cycles of gemcitabine. So what we call a sandwich approach: gemcitabine, capecitabine with radiation, followed with gemcitabine again. And the patient told me, "Doc, I'm done. I'm beat up on. I just want to rest, and it is what it is. Whatever life wants for me, or whatever God wants for me, that's what will happen. I don't want anything else done." Okay, so this was back in 2021. Mid-2021, around the time that this patient completed therapy. So at that time, like I said, the CA19-9 was 200. Now I'm just going to tell you CA19-9 levels that since 2021 to now, what they've been doing. The baseline, several years ago, for whatever reason, I found an older CA19-9 and it was 23. So this is a patient that several years before this had a totally normal CA19-9. So after treatment, the CA19-9 was 37, and this is months, one after the other. Every few months, I'm following these levels. 37, 54. When I saw the 54, I started to get a little worried. Then it went back down to 19, which is normal. Normal is 35 or less in this as a reference value in this lab. Then it was 53. So again, I started to get worried, and all of a sudden, 96. This was in 2023. So if you know anything about pancreatic cancer, especially with 6 positive lymph nodes, 6 involved lymph nodes, as well as an involved margin, this patient is already in 2023, and the imaging studies, CT scans and or MRI scans, were completely normal. I did not do another PET scan because the initial PET scan was negative, so I really didn't think it was necessary. And after this, imaging tests were negative. The follow-up was 45. And the reason I'm presenting the case is that here we are. At the time that I saw this patient, it was August of 2024, and the CA19-9 was 34, so it's normal. And the newest or latest MRCP is completely normal with no evidence of disease. The patient looks fabulous. I'm ecstatic. So guys, this, to me, this is a home run. Here you are a few years after surgery for pancreatic cancer, very high risk pancreatic cancer, positive or involved lymph nodes and involved margin. I have to tell you, this is a fascinating case. I'm very happy for this patient. You know, it really, and like I said at the beginning of this video, it's these cases that really give me a sense of hope. And that's why this is the encouraging case that I wanted to present to you today. So I'm going to be presenting other cases to you. Again, the idea is if it's helping me, it might help you. So give it a thumbs up, subscribe, like, leave me a comment, and all the best to you.